We have arrived at the fourth and final segment of the Community Program Planning Series, Your Role in the Planning of Mental Health Services. Briefly reviewing what we've covered so far, we learned a little of the history of mental health treatment, we learned about the Mental Health Services Act, and we learned about the Community Program Plan. So now that we know, the next question is, why should we care? We care because chances are good we are a mental health stakeholder. A stakeholder is an individual or group that is directly affected by the quality of mental health programs and services. Stakeholders include consumers, their families, caregivers and service providers, mental health advocates, policymakers, and concerned community members. So maybe you do care and you would like to participate but aren't sure how. The MHSA requires counties to provide training for community program plan participation. Some of the ways our county provides for stakeholder participation are regular stakeholder meetings, such as the District Advisory Committee meeting and Behavioral Health Commission meetings, special Community Policy Advisory or CPAC meetings, cultural group subcommittees, and special subcommittees. Subcommittees may be formed to address the needs of underserved groups. For example, rural consumers are historically underserved in mental health services. Forming a rural subcommittee ensures residents are represented and their needs are made known. Subcommittees should have specific goals. A rural subcommittee's goal, for example, might be to address service disparity by increasing consumer service connection. Questions such as who can't connect, why can't they connect, and what services are most difficult to connect to might arise. A possible first step might be to answer these questions. Once these questions have been answered, the findings would be used to prepare for the ask. The ask is a request for a service or provision to be included in the community program plan. The ask should align with consumer wellness and recovery goals. The ask should be formatted using the SMART goal metric: specific, measurable, attainable, realistic, and time bound. Suppose a subcommittee found there was a need to increase consumer and family knowledge of mental health programs and services. An example of an ask might be a budget allocation of $20,000 in the CPP for community outreach activities to pay for staff, space, travel, and supplies. The purpose of the outreach is to increase consumer wellness and resilience by increasing knowledge of and participation in mental health programs and services. Funding will cover 4 CPP trainings and 4 participation activities, vendor attendance at 4 community events, and hosting 1 annual awareness event to inform at least 100 community members, train at least 30 consumers and families, and increase CPP participation by at least 20 consumers and family members annually. Realistically, 100 people can be informed, 30 people can be trained. CPP participation can be increased by at least 20 people, and it can all be done within 1 year. We hope you enjoyed this presentation and that it inspires you to get involved in the mental health programs and services in our community. This concludes the Community Program Plan presentation. Thank you for listening.